Hi there, everyone. Today we are talking about prevention and first aid for burns in babies and children. My name is Sarah Hunstead. I am a paediatric nurse, mum of two, author of A Life, a Finger, a Pee, Up a Nose, which is probably, I'd count it as my third baby, to be honest. And I have the delight of being the founder of CPR Kids. And at CPR Kids, what we do is we empower parents and families and carers of kids with the life-saving skills of baby and child first aid. Now, as I said, today we are going to talk about burns, but before I get into that, can you please give me a thumbs up or a wave just to make sure all the technology is working as it should be? That would be fantastic. And please tag anyone in the comments below who you think can just benefit from this good evidence-based information. Because everything that I'm talking about today, it's not made up, it's not from Dr. Google, it is from good evidence-based places. So first of all, let's talk about, why do we need to talk about burns in kids? Well, particularly we're coming into winter now and we have a lot of those warming hot foods, the liquids, we've got the heater on, we've got all of those different things that can increase the risk of burn injuries in kids. And so what I want you to do is anybody who's tuning in live now, so we will be posting this recording to our pages afterwards as well, so you can watch it again. But if anybody who's on now, what I want you to do is just post in the comments below. I'd love to know where you're watching from for a start, but also what do you think the main types of things that cause burns in kids? So do you think it's heaters? Do you think it's hot liquids, cups of coffee, tea? What do you think it is? Because it may surprise you. Now, one thing I want you to know is that there are different types of burns, okay? There are 6 main types. First of all, there are the scalds, which are caused by hot liquids or foods or steam. Then you've got the flame burns. You can also have contact burns, which is when a child might put their hands onto such as a heater or hot surface, something like that. Maybe, after you've had the stove top on, they've popped their hands on top of there. Or even a very cold object. Sometimes we don't think of things like dry ice. Not that kids can really get into that too often. There can also be friction burns. So I've seen that because my background is I'm a paediatric emergency nurse. I've seen friction burns from children on treadmill accidents as well, and they are just awful. And of course, there can be chemical and electrical burns as well. So thank you. Oh, wow, we've even got people, here from Canada. That's absolutely fantastic who are watching from Perth. I'll tell you what, when we do these, we see people from all over the place because what we do know is this is not something that is isolated to certain geographical areas. This happens to kids all over the world. So it's so important that all parents and carers know. Okay, so what is the most common type of burn in kids? It's your scalds, okay? Because what they do, they are curious little creatures. They want to reach up, pull things down. They don't understand that the food in front of them might be hot, or the bowl of noodles with broth that's on the table, if they pull that down on top of themselves, that's going to hurt them quite badly. Also, they don't realize that that cup of tea that you're sipping on or coffee can be really, really, really hot. Now, one thing that we need to remember is, and I love saying this because it's so true, is that we are leathery old crocodiles in comparison to kids. We can withstand higher temperatures for a longer amount of time than what that beautiful fresh skin of a child can. So that hot cup of tea that you might be able to just kind of go, have that little sip and go, oh, yeah, no, that's a bit hot. You might be able to dip your finger in it and you go, oh, ouch, that's a bit hot. My finger might go a bit red, disappears pretty quickly. In a child, that can cause a terrible burn that ends up blistering and, their skin is badly damaged. So that's really important that we remember that kids burn at lower temperatures in a shorter amount of time than what we do. So that's an important thing to remember. So let's talk about prevention. Now, kids really, really, really want to copy what we do, okay? So if they see us sipping on our tea or our coffee, they want to do the same. they will mimic us. So they may pull themselves up onto the table and reach for that cup, not understanding that, you know, that the contents is actually really, really hot. So from a young age, we need to teach them hot. Now, I'm going to tell you a story now. And, you know, I want you to realize that this was done under controlled circumstances, okay? It was done under controlled circumstances. Now, my daughters, when we moved into our house that we're in now, they were aged, I think, you know, just under 1 and 2. There's a very small age gap between my kids. And as they were toddling around, our heater is a glass-fronted fireplace, and the glass gets hot. And I was so worried about them being in front of that. So we had a fire guard as well so that they couldn't get to the glass. But what I noticed is they were curious. They were trying to get over the fire guard. They thought this was a beautiful thing. So I thought, okay, they need to understand what hot is. So what we did is we turned the heater on and we let it heat up, not so hot that when they touched it, it would burn them, but hot enough that they would understand hot. So we let them touch it, went hot, ouch, oh, hot. You know what? They never went near it again. They understood that that was hot and they didn't like that. And even when they had, you know, I mean, mine are almost teenagers now, but even the ages 5, 6, 7, they would still go there when they walk past the heater. They'd still give it a wide berth just out of habit from when they were toddlers. And so, you know, I've had parents who say they've had kids who have just been next level curious about the front of the oven or the iron and things like that. And so they've shown them that it's hot, but not hot enough to even go anywhere near burning them, but enough to show them that it is hot. And so, because children often learn by consequence. So that's a way that, you know, we can help teach our kids what hot is, but being very, very, very careful while doing it, okay? So other ways, how can we prevent burns in schools? So first of all, please, let's think about electrical safety and fire safety as well. Make sure your smoke detectors, everything are working. It's an important thing. That's not going to prevent a fire, but we need to talk about that while we're doing this, okay? So make sure you check them regularly. Usually when the clocks go back and forward is a good time to do that. Making sure that we don't have heaters in the room. And if you do need a heater in the room, so obviously, you know, in Canada, probably going to need that. Whereas here in New South Wales, where I am, don't tend to need that. But if that is something that you must have, what is near the heater? Are you pushing an oil heater up against long curtains? Is bedding able to be flicked off the bed onto the heater? Can your child get to it? So these are things that we need to be really aware of. A lot of people have electric blankets. They must not be on while your child is in the bed, okay? If you want to heat up the bed beforehand, okay, but make sure the electric blanket is turned off, please. And the other thing that we need to be cautious of is a lot of people heat up beds with wheat bags. Now, we need to never, ever leave a wheat bag in there. And certainly the New South Wales Fire Authority has written some fantastic blogs on the dangers of having wheat bags and having them under a whole lot of covers that they can actually end up in fire. So I'll post some of those links down below in the comments, but there's some of the things that we really need to think of. So what about the rest of the house? Thinking about the bathroom. Make sure that you have a tempering valve for your hot water system. So what that does is obviously the hot water system needs to heat the water up to a certain temperature, but a tempering valve actually limits the temperature flowing out of the taps in your house, okay? So a licensed plumber can install that. And it's really, really important because there is a huge difference between 50 degrees and 60 degrees when it comes to burning your kids, okay? That is absolutely huge, that difference. So having that is incredibly important. Also, when you're running the bath, make sure if you don't have a mixer valve, if you've got the 2 different taps, please make sure that you run cold water first, then, you know, test everything and then run cold water through the tap last to cool the tap down. Never ever let your kids in the water until you've tested it. Make it a routine in your house. It's a great thing to do, to have that routine. Make it fun. Make it that, mum or dad or grandma or auntie or whoever has to test it first, and then it's like, yay, okay, we can hop in the bath now. So turn it into a game. There are all these things that you can do to make things routine when it comes to safety. Thinking about another thing in there as well, in the bathroom. Now, I would love, if anybody's watching now, if you leave, when you've used your hair straighteners, if you leave your hair straighteners on the edge of the sink. I'm guilty. I do that too. They've got that lovely long cord, and then, you've straightening your hair, you pop it down, you brush, do whatever you need to do. But I do rest them on the edge of the sink. I absolutely do. But what I really want to encourage you to do is please, please, please try to avoid doing that, or shut the door so your child can't come in while you are straightening your hair, because those plates will heat up to like 280 degrees plus, right? Depending on what model you've got, in seconds. And you can imagine, for curious little hands who want to copy what you are doing, what will happen when they pick up those hair straighteners. I remember once there was a mum in one of our classes who unplugged the hair straightener straight away, moved it out of the bathroom and put it on the bed, and her child came in and jumped on the bed right on top of the hair straighteners, and she had nasty burns right across her calf from where she'd landed on the hair straighteners, because they do take a while to cool down. So please, they're one of the big ones in the bathroom. What about the kitchen? So thinking about the oven, thinking about the stovetop, thinking about cords that are coming down to the kettle, things like that, other appliances. And also, this is one that's drummed into us, always, but it pays to remember, turn the pot handles in so curious little hands can't reach up and pull down. Cook on the back burners if you can, okay? If that's an option for you, then please do that. But thinking about these things are really, really important. And of course, in the lounge room, you might have your heater and so on. So if you've got a fireplace or something like that, using a fire guard, really important, okay? So, but the one thing that I really want you to remember, and I'm going to just grab my baby for a sec. Hang on 2 secs. I forgot to bring her with me when I sat down. Now, when we've got Bub in the pouch, okay, might have Bub in the pouch here. We've got our takeaway coffee, all right? Having a drink of our takeaway coffee, yep. And as we drink, lid pops off, hot on top of Bub, okay? Don't stop drinking coffee. You need coffee. You're a carer of children, okay? Probably young ones. You need your coffee, 100%. But what I encourage you to do is, if Bub is in the pouch, if you must drink a coffee, turning to the side, only on the side, coffee is held out here, okay? I prefer that you didn't do it at all while Bub's in the pouch, but if you have to, please be doing this, because little hands can still reach up and knock you, and you can spill that. So that's why I'd encourage you not to do that at all. However, so taking Bub out of the pouch, drinking a coffee while they're over the side, okay? But, or here, we're all about just minimizing, and we know this is real life too, okay? We get that, we understand that. And as a parent or carer of kids, you do need your coffee. Let's face it, you just do. So we've talked about that. Not keeping things on the edge of tables, your hot liquids, your bowl of noodles or soup or whatever. And often at other people's places, this is when the accidents can happen too. So if you go around to grandma's house and she's got the tablecloth on the table and the cup of tea, and your child comes and yanks that tablecloth, and that's going to come off. So these are the types of things that we need to remember. Now, I've talked a lot about prevention here. Okay, the reason that, we talk about prevention is because prevention is always better than cure. And remember that accidents still can happen. We can't wrap our kids up in cotton wool. We have to let them get out there and explore the world, but we can minimize risk, particularly when it comes to burns. Now, before we go any further, I'm going to talk about the first aid. But before we do that, there is one more thing that I did want to talk about that I did forget to mention when it comes to prevention. And that is camping, open fires, fire pits in the backyard. Please always put them out with water, copious amounts of water. Why? Because if you pour sand or dirt over the top, the flames might be extinguished, but the coals will stay hot. Even 8, 12 hours later, they can be hundreds of degrees still. So it's really, really, really important you use water to put it out, not sand or dirt or anything like that, because it will extinguish the flames, but not the coals. It will still be so hot. And I've seen lots of kids who've run across fire pit sites, not realizing that there has been one there in bare feet, and they've ended up with awful burns to their feet. So please be aware of that. Okay. All right. Let's talk about the first aid. Now, if I've forgotten any prevention tips, please put them in the comments below, because there might be something that you do in your house or you've experienced that you would like to share. So please write them down below as well. Okay. So let's talk about the first aid for burns and scalds. So the first thing you're going to do is, and I'm going to put all of the fact sheets down in the comments below too, is remove. You are going to remove any clothing, okay? Why? Because a few different reasons. So obviously, if the clothing or jewelry is stuck to the burn, leave it there, okay? Only remove clothing that is not stuck to the burn. Why? So if you imagine that a child has come along, they've pulled down that hot cup of tea all down here, okay? So what we need to do is we need to remove their jumper or their top, whatever it is, because we don't want to retain the heat here. We want to remove that hot water. So we take that off. We're also, if they're in nappies, we're also going to take off their nappy. Why? Because that hot liquid could have gone down inside their nappy, and we don't want that. Okay, that's really, really important. Because why? Because nappies are designed to retain heat. So what will happen is they'll end up with awful genital burns. So always remove the nappy. Okay, so we've removed their clothes, removed their nappy, etc. So any jewelry, and unless it's stuck to the skin. If it's stuck to the skin, you're going to need to leave it there. Okay, that's really, really important. Now, sometimes if you've got scissors available, you could cut clothes off, etc. But, you do the best that you can with what you've got. Now, the next thing we're going to do is cool the burn. But we're going to cool the burn, not the baby. Okay, cool the burn, not the child. So we need to keep their unburned areas warm. So that might be with your body heat, keeping them, you might step into the shower and have the shower going on over their tummy, but you're keeping them warm with your body heat. You've got towels wrapped around their unburned areas. They might have their hand burnt. So you're keeping them warm, but you've got their arm underneath the kitchen sink tap, just gently flowing over the top. If it's their face that's burned, what I encourage you to do, or, another sensitive area, is have one of these in your first aid kit, okay? The reason why, because these spray bottles, what we can do is just fill these with just tap water, because we are cooling for 20 minutes with just cool tap water, okay? We're not using ice. We're not using anything like that, because that can cause more damage. We're just using cool tap water. And if we just fill this, and mind you, don't use one that's being used for chemicals. Buy one that's got nothing in it, just from the supermarket or the hardware store, and keep it in your first aid kit. And it's only for cooling burns. The only thing that goes in it is water. And then what we can do is we can have a nice gentle spray, and we can gently spray that over the top of the burn. Okay, so we've got that cool running water over the top of the burn, okay? This is a really nice, gentle way to be able to do that, because can you imagine if you had a burn to your face and somebody's trying to shove your face under the water? That would be absolutely awful. So having one of these things is absolutely brilliant to keep in your first aid kit. Okay, really important. All right, so what do we got here? What else do we need to do? So we've removed the clothing or jewelry unless it's stuck to the skin. We then cool the burn, not the baby or child, for 20 minutes with cool running tap water. We're not using ice. We're not using anything else on there. Okay, so we're doing that. Next thing we're going to do is, if we're going to look at the burn, okay, have a look. If you can't even see where it is after the cooling, awesome, fantastic, probably right. Okay, great. Maybe it's just a teensy bit red. That's okay. All right, that's good. Keep an eye on it. All right. If your child's settled, it doesn't seem to be bothering them, then I'd say you're fine. Okay. However, if you look at it and the skin is disrupted, so the skin has come away, the skin is blistered, it's looking red and angry, your child is in pain, even if you're unsure, you need to seek medical help. So the first thing we're going to do is we're going to cover the burn before we seek medical help. So you can cover it with sterile non-stick dressing from your first aid kit. If you don't have anything else with you like that, then potentially you could loosely cover the burn with some cling wrap. Okay, so just the plastic wrap, I think, whatever brand's names, Glad wrap, Saran wrap, all that kind of stuff, not tightly, just loosely over the top. That's if you don't have any non-stick dressings in your first aid kit. So remember, here at CPR Kids, we're always about you do the best that you can with what you've got. Okay, so that's important. So you could do that. And, then what's really important is don't put any creams, lotions, egg white, honey, nothing, no aloe vera, nothing over the top of the burn, because you need to seek medical help. And that doctor, nurse, whoever is going to need to look at that burn. And if they can't see it because it's got egg white or lotion or anything over the top, it is going to be incredibly traumatic to be able to wash and wipe all of that stuff off the burn, to be able to assess it and do what they need to do to dress that burn. So please don't do it, okay? Now, you should seek medical help immediately if the burn is deep, even if your child doesn't feel any pain, because deep burns, so full thickness burns, aren't painful because all the nerve endings have been burnt. So please, it's really important. Often the really superficial burns can be the most painful, but if the burn is deep, they may not have any pain. You need to call an ambulance immediately, and trust me, you will know if it's deep, you'll see it, okay? Now, if the burn is larger, then, we say the size of, a 50-cent coin, which is around 3 centimeters or so. Definitely if the burn is, larger than the palm of your child's hand, of course, but, you might have an 8-year-old child who's got the burn the size of their palm, which is the size of my hand. That's really large, okay? So generally the Royal Children's Hospital in Melbourne, what they say is a burn that's larger than 3 centimeters, or if the burn is small but it has blisters, okay? So even if it is just a little burn over here over the joints that's blistered, you need to seek medical help. Why? Because we don't want any scarring. If there is any scarring, then what can happen is that they can end up healing like this, and they've got lots of growing to do because scars don't grow, okay? So that's an important thing that we remember, is that basically if the burn has disrupted the skin in any way, you need to seek medical help. If the burn is on the face, on the hands or the genitals, over a joint, okay, then we absolutely need to seek medical help. And I would be calling an ambulance if the burn is over the mouth, face, to the throat, neck, any risk of airway around the chest, then please seek medical help. If you're just worried or you're not sure, okay, seek medical help. What happens if the burn is across here? Your child's settled, you've cooled it, but you can't put them in their car seat and put their 5-point harness on. You need to call an ambulance, okay? So I want you to think about that. That's really important. Now, the other thing too is you need to seek help quickly. We don't want that non-stick dressing or that cling film on there for too long, because it can, we don't want it to trap heat or do anything like that. And children can they can lose a lot of fluids through their burn as well. So if you need to seek medical help, you need to, make sure that you're onto it pretty quickly. Don't wait a few hours. You're going to do that. And of course, you can absolutely give them some pain relief. Okay, please do. Burns are painful. So please give them some pain relief. Follow the directions on the bottle, okay, according to your child's age and weight. All right, so please do that. So please remember, don't put anything else on the burn apart from water, and then a non-stick dressing, and for a short period of time, so less than an hour, some cling film, okay? So just be aware of that. And remember, call an ambulance immediately if your child has a severe burn injury. It's a really, really important thing to do. So what we've talked about is remove the clothing and jewelry, cool the burn for 20 minutes with cool running tap water, whether it's from the tap, whether it's from one of these, okay? But we cool the burn, not the baby or child. So we're keeping their unburned areas warm, okay? We're then going to cover the burn with a non-stick dressing or, some cling film, but just for a short period of time until we can seek help, okay? So less than an hour with the cling film. And then what we're going to do is seek that medical help. And remember, if you are unsure, please seek medical help. If they are in extreme pain, if the burn is to a sensitive area, if you can't transport them safely, if the burn is deep or extensive, please call an ambulance immediately. Okay? So before we go any further, are there any questions about burns? It's pretty straightforward with what we need to do, but remember, prevention is better than cure, but accidents happen, okay? They do. And remember, children will burn in shorter periods of time and at lower temperatures than what we will. Now, I've only gone through really the thermal burns here, so the scalds, those sorts of things. Haven't really gone into sunburn or friction burns, but regardless, for a burn, the treatment is the same, and that's what we need to remember. So remember, any doubt, please seek medical help. I'm going to post some fact sheets down in the comments below. Thank you so much for joining me today, and we will see you tomorrow. You can tune in tomorrow. We are doing a Facebook Live with Dr. Deb Levy, who is a pediatrician, and we are going to be talking about ear pain in children. So if you're watching this recording, we will also be putting the recording of the ear pain in children onto the CPR Kids Facebook page and YouTube channel as well. Okay, so thanks for joining me, everyone. We will see you again soon. Okay, bye.